so this next two prone tests I'll do, being that they're both rotation of the hip, we're gonna be looking at medial and lateral rotation. And so I know you guys know how to do medial and lateral rotation of the hip in prone, so I'm just gonna kind of talk you through some of the dysfunctions. But according to Sauerman, she's saying that 35 degrees of lateral rotation and 35 degrees of medial rotation is kind of the normal that we're looking for, but it can vary across sources, right? As you're well aware. We're looking for symmetry or excessive movement in only one direction, right? Because if you have excessive movement in one direction, you should be thinking anatorsion or retrotorsion, or anaversion or retroversion, right? And that's where the Craig's test can come into play. So we're gonna be doing medial and lateral rotation. Okay, so I'm gonna bring our knee to about 90 degrees, as you guys know. And again, you can monitor the greater trochanter. Okay, so foot goes out, we're doing internal rotation. I'm looking, does her knee want to abduct? She easily gets 35 degrees. External rotation is actually quite a bit tighter, which makes sense to us because we know TFL is short or stiff. So now it's a common theme, right? Technically, she's extending at the hip. I'm asking her to laterally rotate, and she's like, no, I don't like that position. So TFL is most likely restricting us here. If she flexed her hip or allowed her pelvis to rotate, she could cheat for us. So external rotation, she does not get 35 degrees. Okay, internal rotation, she does get 35 degrees, okay? So I would say TFL is showing up again here for her. But other dysfunctions that you might see is if we externally rotate and she gets like a ton of motion, like 50 degrees or more, and then we go to internally rotate and she can't even barely break neutral, we're thinking that that's probably more of a retroverted hip. Could be more structural than anything else. Okay, and you can sit and run Craig's test to confirm. Vice versa, if we do internal rotation and she goes all day, right? She gets more than 50 degrees, and then we can barely externally rotate, then we're thinking her hip might be anaverted or have anatorsion involved. And again, that's probably more of a structural problem that we won't be able to fix. Okay? If she can't internally rotate, her external rotators are probably short or stiff. Or it could be a joint problem, right? Which we'll find in the other tests, like the active straight leg raise, or the unilateral or bilateral knees to chest. So again, if she can't internally rotate, external rotators are probably short or stiff. If she can't laterally rotate or externally rotate, the medial rotators are probably short or stiff, which in her case, the TFL is. Okay? So that's internal and external rotation and some of the dysfunctions that we'll be looking for.